I would explain to you, if you are in my office, what epidural space is, how we are going to go there, and what could go wrong. Well, what could go wrong could be 1 in million, but if it happens to somebody, for him it is 100%. So that's why it has to be explained, and today I'm explaining that. Most important thing is take the fear out, because nowadays the technology helps us to reach those areas where we couldn't reach before these technologies. One source of fear of epidural injection is that women at the time of delivery, they are getting epidural injection to control the labor pain. Now remember that epidural approach is for numbing the perineum, that means between the legs, the area from your genitalia to anus, that is perineum. So that is where you need numbness, and in the lower abdomen. So you have to enter at a higher level, where in front of the needle is spinal cord and a fluid-filled sac. So you can enter into those and cause some excessive pain or dysfunction. While epidural injection, which is done for low back pain, is done in a different approach. So that fear should not be there. So distinguish between the different epidural injections. If you don't distinguish between these different injections approaches, you might be filled with fear, and you might hear the stories of epidural injections, because those epidural injections are done without the help of these technologies. At that time, there is no x-rays. We don't want to expose the pregnant woman and the newborn baby to radiation. So they are done blindly, even though the expert person can really figure it out how to do it, but still it is done blindly. The other thing is it is done at a higher level. So the first thing is take out of your mind the epidural injection which is done in the labor time. The second part, in the low back, when we enter, there are different approaches. So we have the ability of a fluoroscope, which is also called C-arm. By moving that, we can see in 3 dimensions the needle, where it is in the tissues and where the tip of the needle is. The further safety occurs when we put a contrast, which we can visualize, which we can see it's going in the epidural space.